Yes, study this question very carefully. We are going question by question. We are not going to do 100 questions. We are going to do 6 questions only. Yes, good evening, Manjula. Good evening, all of you. So, just think about this question. The same style for reading also. It's both for reading and listening. Here only you will see, in reading you will see the text, in listening you will hear the text. That's all, no difference. Everything is one and the same. Yes. Now, in the chat box, okay, I'll be asking some questions, then you have to mention them. Okay. We are starting, okay, brainstorming session. Brainstorming session. Are you ready? Tricks. Are you ready for the tricks? Yeah. Are you ready for the tricks? Yes, those who are ready for the tricks, just let me know, because the same technique you'll use for reading also, for listening also. Yeah. Yes. So we have 3 yeses, Hanifullah, then Manjula and Nina. These 3 people want some tricks. Okay. What about the others? Okay. Fine. Now there I'm going to ask you. Okay. Who is the speaker? Who is the speaker? Is she a doctor or a nurse? Who is the speaker? Is she a doctor or a nurse or a podiatrist or what? Who is the speaker? Come on. So these things are very, very important. These things are very, very important. That's what I'm going to show you now. So if you can analyze these things, it will be easy for you. Who is the speaker? So a nurse is speaking. Okay, fine. Yeah, all of you activate. Afterwards, you will not. I am helping you now. Afterwards, you cannot. And second question is, okay, who is the listener? Who is the listener? Who is the listener? Come on, give your answers. Who is the listener? Who is the listener? Come on, all of you, active, whatever it is. Colleges is wrong. Okay. Yeah. So is it Singular or plural? One person, only colleague, her colleague. Her colleague means co-worker. Colleague means co-worker. So colleague means co-worker, working together. Okay, fine. That's okay. Next one. Who do you think? Third one. What profession do you think? What profession do you think is the colleague? What profession do you think is the colleague? So here you have to think and imagine, what profession do you think is the colleague? Is she a nurse? Is she a doctor? Is she something else? Okay. Come on, write down. This is how you have to think. Very fast you have to think. Very fast you have to think in the exam. At least now I am giving you time. If you learn how to think, then you can apply that in the exam. Practice every day. Yeah, you think she is the colleague is a nurse. Okay, very good. Fourth question. About whom is she talking? About whom is she talking? About whom is she talking? Yeah. You have to be very careful. It's not patient, it's a patient. Remember that, a patient. Okay, singular, plural, very important. You have to be bothering about these things. Okay, a patient. So she's talking about a patient. That's fine. Now, she is doing something. Is she explaining or is she demonstrating or what is she doing actually? Okay, when she is speaking. So next question, fifth one. What is she doing? What is she doing exactly? Is she explaining? Or is she demonstrating? Or is she detailing? Or is she communicating? What exactly is she doing? In one word you have to give. Doing. Okay. Because most important word is that only. What is she doing? No, she is not explaining. Hanifullah, she is not explaining. He is not explaining. Okay, not he, she. She is not explaining. Yes, Branjula, briefing. Yes, Nina. Okay, warning. Okay, in the first line, I'm talking only about the first line. Okay. She's warning only? No, she's not warning, actually. She's not warning, she's giving a briefing. She's giving a briefing here. Remember that. And in that briefing, there are many things, positive and maybe one negative. One negative is called warning. In that briefing, there may be two positives and one negative. So if three negative, then all warning. Okay. So briefing. In this briefing, there are 3 points. All the three she will be telling maybe. Okay. Right. So she is briefing many things. In that one, she is warning the other person to be careful. Other things, no need to be careful. So here, she is briefing. The correct answer is briefing. Is briefing. Now, what do you mean by briefing? Come on, write down. What do you mean by briefing? What do you mean by briefing according to your point? Because in this word, there is a secret. Okay. In this word, there is a secret. What do you mean by briefing? Briefing means what? Briefing means what according to your knowledge? Come on. What do you mean by briefing? Maybe you did not use this word when you are speaking. Okay. Briefing means what? Briefing means what? Yeah. Come on. Briefing means what? Yes, briefing means what? Briefing doesn't mean explaining. Briefing doesn't mean describing. I'm sorry. I'm sorry. Then he would have given explaining, na? He would have given describing, na? Briefing means what? Come on. Yes, Muttulakshmi. Precise explanation. Precise. Precise. Brief. Precise. Means long story short. Long story short. Sometimes people will start beating her. Yesterday I went there, I did this, I did that, I did this. No. Tell the long story short. I don't have much time. That is what is briefing. You should know the meaning of that word. Then only. So in this briefing, she is telling some bullet points. Briefing means bullet points. Your case notes is briefing. Your case notes is briefing. Your letter is explanation. Your case, explain the case notes in a detailed manner. So detailing is expansion. Briefing is compression. Why don't you understand the word? Briefing means compression. Compressing means shortening, limiting. Okay, limiting to only important things. That is called long story short. Many things are there. Some important things only she will tell. Bullet points, 1, 2, 3. That's it. Okay. Concise, brief, limit, precise. Okay. So this is what the point is. Now, in this briefing, there may be positive points. There may be negative points. There may be neutral points. I'm telling you the secrets. There may be positive things. Oh, she's good like this. She's good. She's this better. She's wonderful. Progress is excellent. That positive things. Negative things. She's confused. She's worried. She's shouting. She's angry. These are negative points. Neutral points. She's cool, composed, normal, everything like that. No problem. It's okay. No, neither difficulty nor normal. Neither positive nor negative. It's okay. Okay. That is neutral. So neutral also can be considered positive. But negative points, for example, you see a snake. You are walking on the road. Your child sees a snake, or your friend sees a snake, or your brother sees a snake. And suddenly, stop, they'll say. Why? There is some problem if you do not see. They stop. Because one step further, the snake will bite you, or you'll fall into a pit. So they say, stop. So this is a warning. Why do you give warning? To avoid from some danger. So negative points are dangers. Negative points are dangers. Now these dangers, if you don't notice, there may be a problem, serious risk. There may be some risk. There may be some negative things. There may be some negative things. There is a certain level of risk. Okay, you will end up in a problem. Life may be at stake. There may be a disaster. All these are negative. That's why you give a warning. When do you give a warning? The next question is, when will you give a warning? This is the big question here. When will you give a warning? Briefing, in that briefing there are many points, but one point is related to warning. When will you give a warning? When will you give a warning? Come on. When will you give a warning? Come on, think. When will you give a warning? Yeah. Yes. When you notice some difficult situation, to avoid the difficult situation, you'll give a warning. Preventive measure. Warning is a preventive measure. Preventive measure. Okay. To avoid some difficulty. To avoid. Okay. Some problems. To avoid some problems, will give warning. So there is something problem. Others are not problematic then. Okay. There are some problems. Others. So one problem is there which should be avoided. Warning is there to avoid the problem. So now what is the problem here? Try to understand here. Now warning related to what? The patient is allergic to some types of antibiotics. So allergy is a problem. Allergy is a problem. The patient is allergic to some types of antibiotics. The patient is allergic to some types of antibiotics. Number one. So allergy is a problem. So don't give those antibiotics which is allergic to. The next one, care must be taken to prevent the patient from falling. Falling is the problem. He'll fall down. He will hurt himself. Okay. The patient, right, may fall down and hurt. Maybe from the bed or while standing, may fall. Oxygen may be needed if the patient becomes breathless. So breathlessness. These are the three problems. All the three are problems. But two problems are not problems here because they may have been already managed. Only one is the serious problem. Others are not serious problems. All the three are problems here. All the three are problems. Yes. Now here, all the three are problems. I'm telling you the secrets, okay? I'm telling you the secrets here. Now, yes, today we have a new student, Dr. Jyotsna Chabrani from UAE. Hello, Dr. Jyotsna. She registered today and she started the classes today, okay? No problem to call your name, right?
Yeah. Yeah.
Okay. Allergy, is it a problem or not?
Allergy is not a problem.
Allergy is not a problem?
It's a problem, but
Yeah,
patient
okay.
is
Allergy
already
is a
taking
problem. No, no.
problem,
I'm asking
but
you in general sense.
yeah, in
I'm
general
asking
sense,
you in
it's a
general sense.
problem.
Allergy
Yeah.
is a problem or not?
Definitely, yeah. But in this sense, in three means other.
No. Don't imagine here.
Okay. Yeah.
Allergy is a problem or not?
Yeah. No, it's a problem. Definitely, it's a problem.
If you say it's not a problem, then that means it's a big problem.
No. It's
Allergy
a problem.
is a problem.
Yeah, it can create.
It is a problem. Clear.
Yeah.
Finished? Otherwise, we will not write here. Na?
Yeah.
Allergy is a problem. Negative.
Yes.
So you should avoid giving those antibiotics. Okay.
Yeah.
Now, next one. Care must be taken to prevent the patient from falling. Falling is a problem or not?
Yeah, it's also problem.
Breathlessness is a problem or not?
Yeah, it's also problem.
So these are three problems.
Yeah,
but
the
nurse is warning her colleague about only one here. Three cannot be right?
Yeah.
That means one is a very serious problem, and others are not problems anymore because they have already been managed.
Yeah.
You understand what I mean now?
Yeah. Definitely.
Don't see from a student's mind. Don't see from a child's mind. Okay. See from my mind. My question is very straight. Allergy is a problem. Yes. Falling is a problem. Yes. Breathlessness also is a problem. Yes. But she is warning only about one. She cannot be warning about three. Yes or not? Common sense.
Yes.
A, B, C, only one can be right. Correct? All the three cannot be right. Even two cannot be right. Only one problem, right?
Yeah.
So if three problems are there and the nurse is warning about only one problem, that means the other two problems are not that serious problems.
Yeah.
Either they are already managed.
Yeah.
Okay. Or something is already taken care of them.
Yes.
Problem is always a problem until some care is taken. So that means there are no more any problem.
Yes.
Is that clear?
Yeah, clear.
So now we are going to listen to this. We are going to listen to this.
Okay.
So that's it. You can mute back. Right.
Okay. Thank you.
Yeah. Now, are we ready for listening now? Mentally, are we mentally ready for the listening audio? So mentally you have to be ready. That is what it is. Mentally you have to be ready. Yes. Now patient, patient, patient. Everywhere is a patient. Patient is commonality. It is no more important again. Okay. That's it. So, right. Now I'm going to play the audio. Get ready. Oh, my video is on. Okay. Yeah. Question number 25. Okay. Listening. 25. Yes. One. Yeah. So you have to consider all these things. Okay. Right. There is the question.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear a nurse briefing her colleague about a patient. Now read the question.
Mrs. Green was admitted last night for pneumonia. She came in yesterday with a cough, fever, dizziness and chest discomfort. She's a healthy 60-year-old with a history of right knee replacement 5 years ago. She's on a regular diet and has no allergies. She's at high risk for falls due to her dizziness. We changed her IV antibiotics to oral, which she's tolerating well. Her assessment is within normal limits, except for some mild shortness of breath and wheezing. Her vital signs are stable, oxygen saturation is 98% on 1 litre, and she's been comfortable during my shift. Around 5:30, I gave her 2 paracetamol for minor pain, with good results. She has an 18 gauge in her left arm. She's got normal saline at 15 mils per hour.
Okay.
Question 26. You hear the manager of a care home for the...
Yes. Don't write the answer now. When I tell you, that time you write. Okay. Question 25. Yes. 7, 6, 5, 4, 3, 2, 1, and submit. Yeah, all of you can write your answers. Okay. Answer 25. Yes, that is the right answer. So submit your scores. Update your scores 1 by 1 or 0 by 1. If it is right answer, it is 1 by 1. If it is wrong answer, 0 by 1. Yes. Now here, you have to remember 2 points. Okay. You have to remember 2 points here. Right. Now, if you take first one, antibiotics. She is allergic to some antibiotics, but you have given some medication and she is able to tolerate well. She has been tolerating well. So antibiotics are tolerated. She has been tolerating well. That is, A is ruled out. The next one. When she joined, she had some problem, but afterwards her oxygen saturation is 98% and exception of mild shortness of breath. Mild shortness, not very serious. Mild shortness of breath. She is fine. That means C is ruled out. She has high risk of falls. That means anytime she may fall down. High risk. Now try to understand, these problems are with some negatives or positives. The problems, the extension is given, it may be negative or it may be positive. Now what is negative, what is positive? Now let us see. She is allergic to some medications and we have given so and so medication and she has been tolerating well. Well, she has been tolerating well. That means, is it positive or negative? So problem is no more a problem. Problem is no more a problem because the problem is managed effectively. The next one. She was given oxygen and now the saturation is 98%. She has no problem with the breathing except some mild shortness of breath. Mild shortness of breath. Mild. Moderate means average. Extreme shortness of breath is a problem. But mild, very less than 10%. Okay. So it is no more a problem because condition managed properly. So C is ruled out. So mild shortness of breath. Breathlessness is very mild. Extreme means negative. Extreme shortness of breath is negative. Mild shortness of breath is positive. It's going up the ladder. So it is positive. Okay. It is positive. Shortness of breath is there, but it is very mild. Very mild. So it can be considered positive. Now it is managed well. Now she has high risk of fall. This cannot be managed so easily. This cannot be managed so easily. So every time you have to take care. She has high risk of fall. So be careful. Always be watching. Always be watching. So that's the point. So this is how minus with plus becomes plus. Minus and minus. High risk. Risk is minus again. Okay, a fall, falling. She will hurt herself. And this hurting, the risk is very high. Not moderate, not mild. High risk means extreme risk. The problem is too high, is a serious problem. So only for serious problems we'll give warning. For ordinary problems, manageable problems, mild problems, moderate problems, we will never give warning. So now When I call somebody, you can just come on the screen and you can give the explanation. Yes. So today we have, who is that? Dr. Jyotsna. Yes. Let me introduce Dr. Jyotsna to our group. Yes, Dr. Jyotsna.
Yeah.
Can you start your video, please? Yes. Yeah. So you can explain in your own words. Okay. You can start your video and you can explain. Yeah.
Yeah. 1 minute.
Yes, yes, yes. And you can explain how beneficial was this explanation.
Okay. Yeah.
Yes.
Good
Yeah,
evening.
this is Dr. Jyotsna Chabrani from currently UAE, but originally from Nagpur, India. Yes, Dr. Jyotsna.
Yeah. Regarding this question.
This particular question.
Yeah, because she's telling that patient undergone knee replacement, and we should avoid to fall down. And other point, she's telling that patient is tolerating medicine. That means she's not mentioning that she is allergic to any medicine. That means A option is not correct. And regarding C, she is not telling that oxygen is needed, and regarding breath, she is telling that she is maintaining oxygen saturation properly. That means C is also not correct.
Yeah. Did you understand the elimination technique here?
Yeah.
So unnecessary things we can eliminate.
Yeah.
Elimination. See, when you are saying warning, all the three are problems, but only one problem is very high problem, that is high risk of fall.
Yes.
So you have to be very careful. So that's very clear. Now next, we are moving to the next question.
Okay.
Right. You can mute and you can stop your video. Yeah. Yes. Now coming to the point. We're going to the next question. We're going to the next question. So yes, 26. Question number 26. Question number 26. Okay, let it be like that. Question number 26. Yes. Now in this question number 26, yeah. Now let us discuss this question number 26. Now I have already made you understand who is talking, why he is talking, what are they talking. I have explained, so I don't want to spend a lot of time on that one. So I'm going to straight away. So you hear the manager is talking to the nursing staff, all staff members together. The manager is talking, okay, to the nursing staff. He's the manager for what? He's the manager of a care home. He's the manager of a care home. And this care home is for whom? It is for the elderly. That means aged patients. You hear the manager of a care home for the elderly talking to the nursing staff. So you are hearing the manager, and this manager is talking to the nursing staff, and he's the manager of a care home. So the setting is a care home, and this care home is to take care of the elderly people, elderly patients, elderly men and women. Okay. So now he is talking about errors, mistakes. errors when while dispensing medication to the patients. When you are giving medications, to the patients, they result from, usually means commonly, regularly, usually, normally, result from. What is the reason? Result from. Okay, errors are the results. Errors are the results. And the reason is what? From particular reason, result from particular reason. Errors are the effects. What are the causes? What are the causes of these errors? What are the reasons for these errors? Because of what are these errors happening? Errors is the consequences of what? Okay, of what? Right. Interruptions while calculating dosages. He's talking about dosage. Dosage means amount. How much amount? Dosage is amount. Be very careful. These questions comes number of times. Today also I discussed with one student. Okay. Number of amount. What is the amount? 5 ml, 10 ml, 15 ml, or 1, 2, 3, 4, 10. So when calculating dosages, how many grams I should give him? Or how many grams, milligrams I should give her? So when you're calculating according to his age and other things, you're calculating this much weight, so you should give this much, this many milligrams, these many milligrams. Okay, this much amount. Okay, the number of milligrams or grams, whatever it is. The next one, a failure to check for patients' allergies. Allergies. Patient, you have to give dosages. When you are calculating dosages, somebody talks and you'll make a mistake. So dosage, because of that mistake, you are giving more dosage. Because of that mistake, you are giving less dosage. You are not giving proper dosage. Consequence is a problem, error. So you are calculating dosages, your friend is talking, or you got a phone call, that time you are talking on the phone and you are calculating the dosage. Instead of giving the appropriate dosage, you are giving more or less. Less dosage, you're not useful. More dosage, then reaction, some problem. So both are problems. Correct dosage you have to give. So problem is with the dosage. Problem is with the dosage. This is the main word. Because every question means problem. Question means problem. So question means problem. So remember that. So dosage is a problem. Yes, dosage is a problem. Wrong dosage is a problem. Right dosage is not a problem. You'll give right dosage if there is no interruptions. If you are properly handling, you'll do it right. But some disturbance is there, you'll give wrong dosage. Then who is suffering? The patient is suffering. Okay. The next one, failure to check for patient's allergies. A patient has allergy and you did not check. So allergy is a problem now because you did not check. Allergy is a problem. That's it. Allergy is a problem. He has some allergy and allergy is a problem. You did not check that he has allergy or not. And you are giving the dosage and he is allergic to penicillin and you give penicillin without giving test dosage. You did not check properly and the patient is in problem. So allergy is a problem. Allergy is not a problem, but allergy is a problem. I don't have allergy to penicillin, so it is not a problem. But some people may have allergy to penicillin. Okay, so be careful. Allergy may not be a problem, but allergy may be a problem. For many people, allergy is not a problem because they are okay with the penicillin. But for some people, they are not okay with penicillin, so they have allergy to penicillin. So allergy is a problem for some people. Okay, and you did not check. 99 patients have no allergy and for them okay, but one person, Simon, has allergy and he got reaction. Okay, so be careful. The next one, administering drugs late in the day. So administering drugs. So this is drug. This is not amount, this is not allergy. This is drug. Okay, so late in the day. Administering drugs late in the day. So because you are giving late in the day, there are some errors. Okay. So if you give early, means in the morning, no problem. Evening, some problem. So maybe because of timing, drugs. So here, dosage is a problem, allergy is a problem, or drug is a problem. These are three same thing but related one another. Somebody has a problem, you have to calculate the dosage, you have to check whether he has allergy or not, and you have to give that drug either in the morning or afternoon or evening. In the morning, no problem, but in the evening, if they are giving medication, he's getting problem. So try to understand this. So drug itself is a problem because in the morning, if you give, no problem with the drug, but in the evening, if you give, problem with the drug, that is it. So drug should be given either in the morning, but you are giving in the evening, he has problem. That's the meaning. So dosage is the problem. Dosage means amount. Dosage means amount. Allergy means accepting. The body is accepting or rejecting. Drug means a specific name of particular medication. Okay, a particular drug. It's not amount, it's not the reaction, negative reaction. Okay, so allergy is a rejection of drug. Dosage is proper or improper amount of drug, amount, quantity of drug, 500 ml or 200 ml or 300 ml, that is amount of drug. So dosage means amount of drug, that's it. It may have allergy or not. Dosage is different thing. Allergy, same drug, same dosage, but for some it is okay, for some it is not okay. That is allergy, rejection of drug. Dosage is not a problem there. And drug is okay, dosage is also okay, no allergy, but this drug, if they are given in the morning, no problem. But in the evening, late in the day means afternoon, after afternoon, before noon, afternoon, means after 12 p.m. it is late in the day, before 12 p.m. it's early in the day. So early in the day giving drug is not a problem. Later in the day giving a drug is a problem. So try to understand. Dosage is a problem, amount. Okay, allergy is a problem, then drug is a problem. Okay, these three things you focus. Then now he will be discussing amount. Improper calculating dosages will have two effects: proper dosage or improper dosage. Proper dosage, correct dosage, less dosage or more dosage. Okay, more than required or less than required or proper amount. If you have to give 200 mg, you give 200 mg is proper. If you give 200 mg, it is less dosage. Dosage is not required amount. If you give 300, it is over dosage. Under dosage, dosage, overdosage, overdose. Underdose, proper dose, overdose. That's now I think you got it clear. So it should not be underdose, it should not be overdose, it should be proper dosage. Remember that. These you have to be very careful. Okay, all right. Next one, failure to check for patients' allergies. A person has allergy or not allergy. You have to check. If you do not check, because of that reason, yes. So when you are checking, properly, then no problem. Okay, when you are checking properly, no problem. This is related to statistics. Errors, number of errors in a day. How many mistakes happen? So you have some statistics. Based on the statistics, if this count reduces, that means the condition is improving. Not too many. Errors are not too many. Okay, errors reduced. That means growing positive, increasing quality. Errors are increasing because of not checking properly. Earlier there were more errors because people did not check properly. But now we are checking, and these errors because of failure to check, allergies, that's reducing. So that means it's not a problem. That means you are checking properly and you are managing properly. Before giving the dosage, you are checking all these things. Because of this, the statistic related to the allergies are diminishing. Okay, earlier in the past, 10 years back or 20 years back, out of 100 patients, because of this, 10 people were affected. Nowadays, 1 or 2 are affected. That means what? We are managing the condition properly. So it is no more a problem. Okay. Next one, administering drugs late in the day. Late in the day, there are two things here. Early in the day, late in the day. So late in the day, there is a problem. Errors are because you are administering late in the day, it's a problem. That means if you are giving early in the day, there is no problem. Try to understand. Try to understand that one. So think about morning, think about afternoon or evening. Afternoon or evening is late in the day. Morning is early in the day. Remember, these words will come when you are talking about drugs. Calculating overdose and underdose may come. So be careful while you are calculating the dosages so that there should not be any disturbance in order to avoid this problem. So these related words, you should be mentally ready to listen. Now you know when the word answer comes, immediately catch because you are already analyzed the point. So the same style you have to think about all the questions. So every test you don't do the test first, then afterwards take the question like this and try to analyze. Then you listen again. Then you will catch the answer. So now, yes. Now who will readily open the mic? Okay. Yeah. Don't say no. If anybody says no, just let me know because I don't want to hear a no. Yeah, Sandhya Kunjumon. Sandhya Kunjumon, unmute. Are you okay? Unmute, please. Okay, fine. She's busy. Okay. Then, yeah, Nina Johnny. Okay, fine. No problem. What you can do is, you can just message in the chat box. Is the explanation clear? Is the explanation clear? Dosage has three qualities: underdose, correct dose, overdose. Allergy may be an allergy, may not be allergy. If checking properly, it will not be a problem. If it is not checked, it's a problem. This allergy, the statistics may reduce if you check properly. So that means you are improving the quality service. Then next one, administering drugs late in the day or early in the day. Late in the day means after 12 p.m. Early in the day means before 12 p.m. You can say daytime. So this is how you have to analyze the question. Now I'm going to play the audio. Okay, that is the question. Yes.
Left arm,
Yep.
she's got normal saline at 15 mils per hour.
Okay.
Question 26. You hear the manager of a care home for the elderly talking to the nursing staff. Now read the question.
Now, a quick word about the administration of medication. It's great to see how carefully you're all following the new guidelines, and thanks to this, error rates, which were always below average anyhow here, have dropped by 40%. The surveys we've done also throw up some interesting findings, like mistakes being more common in the morning than afternoons or evenings. We're not sure why, but there's a clear pattern. Also, we know that being disturbed for any reason while working out and preparing doses is a common reason for mistakes. So please, try and avoid distracting your colleagues while they're doing this. Finally, we must be on the lookout for drug interactions, side effects, and patient sensitivities. Fortunately, we haven't had too many problems of this nature, but the care needs of the vast majority of our residents are often quite complex.
Question 27. You hear part of a morning briefing on
Yes. Now let us see here. So we have noticed here, usually, the word was common. Okay. When you said usually, the word was common. Errors common. The common reason means cause. Result from cause. The common cause is, try to understand that one. The common cause is distractions. The common cause is distractions while calculating the dosages. The common cause usually means common. Result means opposite is cause. Okay. Result from cause. The common cause. Usually result from a common cause. Usually result from a common cause. Common means usually. Commonly, usually, naturally, regularly, generally, all these usually related words. So you have to know the synonyms. The same word will not be there. He said commonly cause. The common cause of errors. The common cause of errors. That's what he meant. So you should be very clear in that one. So you should notice that particular thing. Okay. You should notice that particular thing. A failure to check for patients' allergies. But mostly, we do not have this sort of problems nowadays, he told. We do not have this sort of problems nowadays. So that's ruled out. Okay. Then administering drugs, they are quite comfortable. They are quite comfortable in the afternoon or evenings rather than in the morning. Quite comfortable, but it's not talking about errors here. Okay, so C is ruled out, and the answer is, okay, answer is A. Yes, answer is A. I'll show you the script now. I'll show you the script. Yeah. Audio script, right? Yeah, I'm going to show you the audio script now. See here. "26. Yeah, here it is. Edit. Okay. You can see now. Now here, if you see very carefully, okay. Yeah. And see very carefully. Yeah. Now you can see. Okay. Now let us see here. Error rates which were always below average anyhow here, below average anyhow have dropped by 40%. Okay. Now, mistakes means errors. Mistakes means errors. More common means usually. More common means usually. Okay. More common in the morning. Okay. In the morning. So not in the evening. So this is wrong. Ruled out. Mistakes more common in the morning. So that is ruled out. It's not in the evening. Administer drugs late in the day? No. Morning, more problem. Okay, next one. Mistakes are more common. Next one. We are not sure why, but there's a clear pattern. Okay. Now let us see here. Next one. We know that being disturbed means interruptions. For any reason, cause. This is the reason will result. Cause and effect. Usually, common means usually. Reason is giving this result. For mistakes means errors. Okay. So while working out and preparing doses, calculating dosages. So the answer is here. The answer is very clear in that particular sentence. Also, we know that being disturbed for any reason while working out and preparing doses is a common reason for mistakes. Common means usual. Reason related to result. Every word you can see. While. Working out. Working means calculating. Working out means calculating. Every word is there. Every word is there. So, that is the explanation there. I hope you got the clarity of the question here. So, you have to understand how it is giving. Calculating, working out and preparing dosages. Dosages. Interruptions means being disturbed. Same word will not be there. Some other alternative words will be given. So mentally be ready for those things. Yes. Fine. So this is the way how you have to analyze the questions. It's very easy. No need of 20 questions, 2 questions properly, and apply these techniques in your other listening tests. Yes. Okay. So let me tell you one thing. Doing 10 tests or doing 5 tests every day is not important here. How many tests you are doing is not important. We don't want hard work. We want smart work. Smart work. Think smart, act smart, answer smart. Don't do too many questions, too many exercises, too many tests. No need. Limit, but quality study you do. That's what I tell. If you study like this, 2 questions are equal to 20 questions. The same technique you go and apply in the other areas. So after 20 minutes, we are going to take a reading session. How many of you are interested in reading class? All are regular students. All are regular students. Nobody is there, other students. Okay? Only regular students. Aisha Murid, regular student. Josna, regular student. Manjula, regular student. Muthu Lakshmi, regular student. Neena Johnny, regular student. Pranita Pamath, regular. Preeti Sehrawat, regular student. All are regular students. Hanifullah is waiting for admission. Okay. So everyone who is serious only will attend the sessions. All others, even if I give, they're not ready. Yeah. Hanif, you have this is just for a demo because you requested. Okay. Right. So you can register tomorrow. And how many of you are interested? Just message me there. So if you are interested, we can start a reading session at after 20 minutes. I'll just take a tea break. So reading session at 10. Reading session in 20 minutes. Are you in? So if you are in, type your name. I'll be sending you the link. Same, reading and listening both are same. Okay, reading and listening both are same. Here you have the text, there you have the audio. Both are English only. Okay. So we'll be going for reading part B. And tomorrow we'll be taking listening part C and reading part C. Tomorrow. Yeah. 20 minutes. We are going to start the session. Yeah, honey, if you can join today's session, no problem. After 20 minutes, we are meeting. Yeah. So I have given you the number of one of my students. Her name is, don't remember her name. She's, yeah, Aisha's friend, actually. Aisha's friend. What is your friend's name? Yusuf. Tasneem Yusuf from Pakistan. Okay. I gave you, you can just register there. Fine. So, Nina is ready, Aisha is ready, Hanif is ready, Manjula is ready, Muthu is ready. Very good. Everyone is ready. So, we'll meet shortly. Take 20 minutes. Do whatever you want and get back to me as soon as possible. You'll get a new link. Remember that. New link, not the same link.